And so good to see you. Welcome right into the studio, Hidden Nation. You got Josh Cary here. It's your hidden entrepreneur, tuned right into 710 WOR, the voice of New York. Sitting here on the iHeartRadio network. Please download that free iHeartRadio app for all things podcast and music in every genre you can imagine. Hidden Nation, we have a great show for you today. My promise to you is that it is going to go more deep than the surface might imply. I'm here with Dr. Baburao Doddapaneni, who is also widely known as Dr. D. He is a pain management specialist and expert with a decades-long credentials and resume in every top position you can imagine, but that doesn't matter. What matters is what you are going to learn for yourself today. Let's bring Dr. D right onto the program. So good to see you, Doctor. How are you today?
Thank you very much for having me on the interview, Mr. Cary. Thank you, sir.
Absolutely, my pleasure. So your book is called Dr. D's Pain Treatment Manual, and it deals with a whole host of ailments, everything from fibromyalgia and beyond. But even more impressive is not necessarily your credits, which I'm reading. You're a Indian educated, British and Scottish trained general surgeon, American trained and board certified anesthesiologist, pain management specialist. You've attended the Royal College of Surgeons and Physicians in London, et cetera, et cetera. But what I adore about your story is your beginnings, dare I say, humble beginnings. You showed me a picture, if you don't mind showing that picture of your home where you were born in India. Tell the listener what we are looking at here.
I was born during British time in 1944, in a colonial British time, in a small farmer's family in southern India. And my father died of a very young age with a lung infection, and he did not have $5. So my father left me as a number 8 and the last child, 8-month-old child, to the world. So I grown up with a very challenging life in the cattle shed with the cattle. Then my mom and me, my mom was 36 with 8 children. I was the last 8 months old. So I survived. Everybody will survive. It is all determined. So I survived in the zero facilities, zero water, or whatever we expect to. So I grown up walking through the schools, finished my high school, then we have no jobs, no money. And I was a child laborer in a hydroelectric power station. I used to work with the laborer job at that time is $2 for a month. So I used to sleep with the laborers in the next to cement bags. That is a way of life in India. Poor, even today, about 400 million Indians live similar or little better life. So I survived with my mom's strong personality. There is always a future, but you have to work hard. You work hard, you learn, obedient, humble, honest, you will have a good future. My mom, from the age of 10, enforced in me. I used to have 2 pairs of clothes. My mom's duty is to stitch them up and hang it on the age where I come from a school. So I never had any negative feelings of poverty. I thought poverty is a chronic disease, but you have to take control. So I came up at the age of 20. I went back to school with my brother gave me about $20 investment. And I went to pre-med school, day and night, 1 year. I got the MCAT, highest score. government scholarships. I was paid up everything by government. Then I finished. I came to Ireland, England. Again, I did advanced courses in the general surgery. I learned the philosophy of religion, what religion was supposed to do, that mixed with the practice of love. Then I came to United States, Boston, liberal Kennedy days. Edward Kennedy was at the time. So I was very much involved with my type of human race around the globe. I never been thought I was born for myself to advance with materialistic things. So in my blood, my mom implanted that value of a human person. You are born here for some reason, not to harm others by selling drugs or shortcutting. So that basis, I was invited to University of Boston, very prestigious university with a medical school. First Indian in 82 became a clinical director on the top of 80 doctors. So I managed the anesthesia department, teaching medical students, and then several years after, I went to practice in New York, Cornell, all this stuff, Basically, in 1983, I have written a book for Indian 1982. Pope Paul was shot in Vatican. Same time, Indira Gandhi was shot. My Prime Minister of India was shot. She passed away. Pope Paul, a much older person, survived. That triggered me. What is wrong with Indian society? They always pray to God. God is not in charge for your health, right? God has so many things to worry about. So I wrote this manual to train Indian doctors.
Wow.
All the emergencies,
You wrote that book to train Indian doctors.
Doctors of the medical emergencies, yes.
Wow.
So I donated to all the institutions in India. Then I transferred some technology, additional things. So that triggered me writing the books. Whatever ideas I have, I gathered. Ideas to search engine documentation. So I do a serious guy. So I donated to all the institutions. Then, 2015, my wife got the ovarian cancer. I have seen this beautiful medicine in this country to extreme. We are the most inventions done in the great country. But then I felt sitting in that room in the Memorial Sloan, walking around outside world, this is the greatest country, I think, indirectly giving an incentive to make people lazy. Drug addiction bothered me when I started practicing in Brooklyn. Government knows it, the drug companies knows it. Doctors are much more corrupt than anywhere in the world in that specialty, right? So that triggered me to write this book. Why? 70-80% of the painful conditions are simply be treatable by simple ways. I researched for next several years, 1917 onwards to, I think 2019, after my wife. Why doctors went to medical schools? Why they're working for archives of medical medicine, serving the drug companies? Very strong thing, I wrote to my congressman, my disappointment with our social responsibility too. Then I found The root cause of this failure is medical students were not taught about how the pain is taken from the source to the brain.
Wow.
They all focused on prescribing and the brain, There's so many things to be done between the brain and the source of pain. So many examples, right?
Can you give us one? Give us an example.
One example I will give you. Somebody having a shoulder pain for multiple reasons. My book addresses that. You don't prescribe narcotics, you treat locally. First figure in my book, I made it easy for the medical students, the residents, practicing doctors. We can't blame them because none of them were trained during the course of medicine, the medical schools or the residencies,
Oh, wow.
These guys are focusing on which specialty pays more money. And the primary care and all during the period of drug violence in our country, people are buying the doctors with the prescriptions, paying them cash. The doctors hand over them 100 prescriptions, making $20,000 something. And that goes to Kentucky and West Virginia, from New York, New Jersey. People are dying on the roads. So that triggered me to write this book. This is, if anybody opens this book, I made it simple, graphical, clearly what causes the pain, any pain. What makes this website of the pain takes 3 steps into the brain. The point is, you can control the pain locally or at the level of spinal cord or at the brain. So clarification, if one day I was traveling in the subway station in New York, the train goes in origin to destination.
Mm-hmm.
Pain is also the origin to destination. I sat down. When my wife was in the hospital, I draw several conclusions. Why can't you make a simple, understandable way? Doctors want easy solution. They don't even talk to the patient. They give you prescription. Then they say, see me 3 months after, if you're alive, right? Okay. I made a wonderful graphic design with the scientific way I have a patent on it. Any doctor, any nurse, any medical students, or a well-educated Joshua Cary, anybody can understand and say, my God, this is the pathway of pain. So I drawn like a London tube or the New York subway, 3 ways of pain. You can see any doctor with little understanding, he can advance himself like a self-learning process, this manual, and also covered 70% for which patient seeks the doctor for the pain. These 70% of doctors in our country, in the name of the primary care, they never had any understanding about this. Only understanding they have during the fentanyl crisis and the oxycodone business. I think the government should bear the responsibility along with doctors, AMA doctors. Yeah. I publicly gave some speeches on it. So instead of introducing a course for a couple of months to the medical student level or a residency level or practicing doctors, you should take a course on standard of medical practice, pain management. Except cancer patients, their pain all the way registered in the brain, they can have a balanced narcotic, whatever. The rest of the things, except few, do not need. Today's fentanyl deaths on the country shape our security or allowing the people to cross with the, for their personal things. So I think this is the time medical students should take a wonderful advantage of this book, from which I wanted to a high percentage I donate to the children education in the poor countries.
Wow. What has been the feedback from the medical community? It seems like such a radical approach. Has there been any pushback or resistance? What's been the feedback?
No, because I have to test it in the proper way, because uh, now I have a source of this Ingram and the Amazon. They accepted, they opened up their eyes,
Mhm.
and they know my slogan. They've seen this 4 or 5 graphic designs I designed, like here to move, every special thing. Example, what are the special cables for made to convey the pain, whether it is a cancer pain or pain in the colon or pain in the appendix or a fracture, all the pain cables are same. So medical students they know there are such a things, they exist in the books, but they were never focused on it. So the medical colleges are superficially, they should take responsibility, not teaching this $100 billion deaths every year in this country. So I made an attempt to see they will get it this time. Migraine, all these big
Mhm.
pictures, arthritis, cancers, all covered in this book, clearly explained what should be done properly, what should not be done. See, a nurse can open and she can also, or clinical nurse can practice harmlessly. Also, my investigations, I'm a very serious person because I struggled my childhood with the no, no silver spoons. So I made a promise to my mother, I will fulfill her dream to be a good person. Anybody can be a doctor. So with that saying, I continuously traveling to India and other places to take healthcare to the poor. Poor can't come to the hospital.
Mhm.
So this particular pain is a symptom, it's not a disease. Several diseases cause pain. Then patient goes to the doctor. If the doctor don't pay attention, shoulder pain, for example, rotator cuff, in my book, I gave a nice demonstration, color pictures, 3-dimensional. Don't be afraid. A simple thing what our medicine exaggerated prices went up is these guys have you put you help me, I'll help you. This is our medical setup now. A referral basis. This guy gets something, this guy gets something. That is a very nasty setup in our present medicine. Our healthcare is a wonderfully failed healthcare. So doctors' education should give them confidence to see shoulder pain, maybe four things. Let me give a shot here. So I simplified in a graphical way. No other book has it. So all the shoulder or the knee joints, commonly, you don't need to arthroscopy, all this stuff, initially you have understand. So every major part addressed in the book, uh, including the drug addiction, what are the reasons, depression, all these
Mhm.
things included in this one. And when to use narcotics. I think the first I have reviewed a lot of books. There's so much storytelling, but they never have landed into practical thing. The drug dosage of narcotics, various narcotics, hydrocodone,
Mhm.
you name it, oxycodone, all this stuff. Nobody, only drug companies push it through. Drug companies push it to start with a very large doses. This is a very important thing to very sad thing to doctors. Most doctors who does it, they should be ashamed of it. To make some human being depending on them to come back with his clinic, pay $100. And the government is a blind faith, knowing that people are dropping dead on the streets of New York, California, or Pennsylvania, all these things. I made questionable argument with the professors of neurology and all. They were promoting the oxycodone in larger doses, 80 milligrams, 100 to 120. So the guy goes to a few doctors, collects them, travels to West Virginia, Kentucky, Florida, right? People are, becoming addicted and all these things. I researched on it. You never, as a good physician, start narcotics in a large doses, like an alcohol. If you drink for a week, a binge, right? You will never stop it. So also my conclusion is, honest conclusion was, as a human being with a social responsibility, no human being needs a calculated dose of narcotic. These doctors, most of them never had any rethinking about it, and they have no common sense either. They're very fearful. So they started with the particular drug, this oxycodone. The deaths are in the, I think the company is now in the bankruptcy. Whom do you blame? I blame doctors, my fellow doctors.
Wow. And
Nobody. Then I tested on my patients the really need for a few days. Whatever these the pharmaceutical companies, along with the fancy gifts to the doctors with a case of some red wine and all, right? I found there is no such thing clockwise. The doctors was forced to do clockwise. You won't leave 6 hours, 8 hours, whether he needs it or not, So they're making him unnecessarily out of their ignorance or greed. So I started, there's no such thing in a human brain. The brain center for the narcotics is next to the sugar center.
Okay.
Or a cocaine center. So I thought, I will never give you more than what I think you need. Like combination, like a Tylenol with small narcotic for 3-4 days. So there are so many gaps in the doctor's training and the doctor's way of prescription intentionally for greed, for the money. And now this book, this manual, a heartfelt gift to, I thought I should revise and I started doing again with a great reception of the, easy way to understand, practice, injections, all the procedural things. Very few needs these expensive tests, Then I also found the studies and the referral pattern in the urban cities like New York. Shame on these specialists or whatever, these guys are sharing the profits. If you refer to them, you will get something back from the expensive procedures. What I found that, So I hope this will help the doctors to be wonderful people, to bring back the glory of doctors' healthcare. That I will say.
My goodness, all because of a promise you made to your mother from your humble beginnings in India.
One person, my mother, yeah.
What a story. I feel like we can just talk on and learn from you. Thank goodness you are here and have documented it all in the book for the doctors to pass on to the patients. Extraordinary work.
Thank you.
Thank you. This is amazing. Hidden Nation. Check out Dr. D, check out the book, and re-listen to this episode. There's a lot, obviously, that Dr. D offered us here, from what it takes to expand and rise up from very, very humble beginnings, from following your path, your dream, and to fulfilling a promise you once made. Thank you again, Dr. D. It's been extraordinary. I appreciate your time.
Thank you so much. It's a pleasure, great pleasure in meeting you. Thank you very, very much. Hope it will help the change throughout the globe, starting with the medical schools. The root cause of the failure was medical schools. Then it will also tells them self-education, self-improvement. Confidently, they can open the book and treat a gout, treat a migraine, treat a cancer, all of them. And I sincerely thank you. Namaste.
Incredible. Calling out the root cause. I really appreciate you being bold and sharing your vision and your message. Thank you, Hidden Nation, for tuning in today. A lot to absorb here. I'm going to go and carry this on for quite a while. Extraordinary information. Thank you for tuning in. We'll do it again real soon. Take care.
Thank you very much. Yeah. Enjoy your day. Thanks a lot.
You too.